mayor is working around in the background there, so he might say some things. And
I'm
we
just
also
here for
have,
the chair.
we also have Camille Oates from Public Health, who, what did I call you earlier? The clinic guru? So
Something like that.
Camille is the clinic consultant who has set up, is this your fifth clinic now?
It's my fourth. Yeah.
So this is now our fourth kind of mass vaccination site here, here in our region. This will replace the Chancellor's Way clinic, so we will still do some limited vaccinations at that site, but this will become kind of the primary public health vaccination site of the 3 and 10. So having said that, we can answer some questions.
So, what's the reason why you're closing the other one? Is that just for logistics, or?
Yeah, so this is just a better site as we scale up. So for a few hundred doses a day, the public health office is more than sufficient. But when we're talking about kind of real mass vaccinations, as those supplies really start to open up, a place like this, you can see out there what it looks like as we're flowing 400 people through a day. There's a real scalability here that we just don't have in our office.
Will that kind of be the normal for people a day, or will it be more once you get up to?
So it's supply dependent, right? So as the supply begins to flow, then obviously we start to open up bookings. I think ultimately the capacity is in the well into the 10,000 to 14,000 doses is kind of the current capacity that we can scale up to. So right now, we're doing about 1,000 a day, give or take, depending on the day.
In Wellington-Dufferin-Guelph.
In the region.
Yeah.
Now, are health regions fighting over, right? So if one of the region wants, they're using kind of even distribution, like how's that working?
Yeah, so
more people around the region. And
all this happens at the provincial level. So all this is directed by the province, and it's roughly population based, though there is some targeting of hotspot areas.
Will they know, like, say, like more elderly population, and Guelph gets more because they have a few more people versus 5?
No, it's really population dependent, and then there are some. They have dedicated some doses to kind of hotspots where they're seeing a lot of cases, but it is primarily kind of per capita.
In terms of the people who received a registration to get vaccinated that originally meant orders for Wellington-Dufferin-Guelph Public Health, are they going to be sent over here to get that vaccination?
Sorry, I only caught the first one.
For those who were who registered to get the vaccination done at the public health headquarters here, and since that's no longer happening, are they going to be sent over to this clinic?
Sure. So the bulk of everyone who would have registered at the time when this clinic opened will have either had their registration done at our office or received this location as their destination. There is a bit of overlap, but they've all been contacted or they are all being contacted.
Is there some wiggle room in the registration process for someone who could choose which clinic they want to be vaccinated?
Oh, there's if you were if you're a resident of Wellington-Dufferin-Guelph, you can go to any clinic in the region.
Right.
And we
so
actually
it doesn't tell you which clinic you have.
No, you can select that. And we'd actually encourage people to do that is if you can make the drive to Orangeville or to Fergus, it's lovely now that we're into the spring. Make your appointment at the most convenient place with appointments.
So for someone who can't register, what can you select? Times, locations, all of that?
Yep, you can both those.
And the types of vaccines that you're giving out here, is everyone trained on like all 4? Because I know the 4 each have like slightly different requirements, and so is it the clinic scalable that way?
Yeah, so I will answer this and then I'll throw it over to Camille. The vaccine team is well trained on vaccinations, and then Camille, do you want to talk just a little bit about how we're doing kind of the shot specific training?
Yeah, so the short answer is yes. Okay, so there's only 3 that we've had in our community right now, which is the 2 mRNA vaccines, Moderna and Pfizer, and then the AstraZeneca, which is just going at this time to primary care. Okay, and so yes, we've been training on this. They're very similar, and things keep evolving. So 2 weeks ago we couldn't travel with the Moderna vaccine, and now we've got the criteria for traveling with the Moderna vaccine. So the training just keeps evolving and evolving as we know more and more.
And how scalable are clinics like this? I mean, like, suppose for a minute, like, you had all the vaccine you could possibly want, could you start, like, what's the capacity for public health to have like a clinic at like Vic Road or, I don't know, anywhere else in the region?
Yeah, so the sites that we have right now, so the 3 sites here in Guelph, the 2 in the county, the mobile sites, and now the physician pilot, there's more than enough capacity for us to get well into the 10,000 doses. If we got a landslide beyond that even, the city of Guelph, the county of Dufferin, county of Wellington have all been great partners on this, so I suspect if we had an overwhelming increase in supply, that those many partners in the region would come on side and we would find a spot. So I think. Yeah.
Yeah.
So I think one thing to point out, and then the mayor's going to jump in here, I hope, is that really City of Guelph, the other regional partners, the lower municipalities, the entire healthcare system, the University of Guelph, Linamar, there's been a real push to not have a single barrier in place to get needles into arms. So I think if we found out, if we got a phone call tomorrow, that we had a massive influx of vaccines coming Friday, Chris Beveridge, who's standing behind all of you in the vest there, he would be on the phone with all those partners and we'd be looking at how we track down more space. But that would be a good problem to have. But right now, the scalability of the current clinics gets us well into 5 figures. And we're not close to that right now. So
Okay.
Because there aren't enough doses to do.
yeah, so just supplies are limited right now. So we're getting about kind of between 3,000 and 5,000 doses a week. From a pure capacity standpoint, we could deliver that almost exclusively at Chancellor's Way if we wanted to.
Okay.
So there is tons of capacity. Krista, you want to?
Yeah, if I can add, our plan is scalable. So we are only getting the 3,500 a week right now. When you look at this pad of ice and what we're doing today, if we do get the, say, 10,000 doses a day, then the second pad of ice would have to be used. So it's scalable in that sense. So that's also in Orangeville and the older street break, and also in Fergus with the double pad ice surface there. So that's the beauty of these municipal facilities, with 2 pads of ice that can be scaled up. So this side would completely be filled with vaccinators, and then this side, when the ice is out, would be filled with people recovering, and then move on their way out. So recovery and checkout. So we'd have 2 full ice surfaces with people moving through getting vaccinated, and that's how it scales up. There's just no need right now because the doses are not at that level of quantity.
Will there be a need in the future though? Like, not just this location, but other ones? I know you just kind of touched on it. Like, I mean, are you planning to,
Need is probably the wrong way to think about it. That's the hope, right? The hope everywhere, not just in WDG, is that we have this huge, and we expect it already. You know, that's sort of what the companies have told us, that over the spring and summer, that's when we're starting to see those bigger numbers of shipments. And that's the problem we want. Like, the problem we want to have is to say, okay, now we need to flip the switch on our scalability plans. That's the thing we're all hoping for, right? Is for us to get the call and say, well, it's not 3,500 doses next week, it's 35,000. Like, that's the problem we want to be solving, that kind of we're ready for.
And so in terms of stuff like removing this ice, that's just gonna happen as a matter of course, like that happens at this time of year anyways.
So I want the mayor to answer that.
But and what happens to the rec programs?
Yeah, Dana is actually in charge of all that on a staffing position, so she's best to answer that.
Hi everyone, so Dana Evans, I'm the General Manager of Culture and Recreation, so certainly General Manager responsible for this facility. Currently, we're scheduled to run ice in the pad next door with our user groups until the end of March. And then we would certainly work with public health to see when we're ready to look to scale up. Does that answer your question?
What typically goes on in this arena in the summertime?
Lots of floor events, lacrosse and sort of field hockey prep, and we're working with users. We think we can balance them in our other facilities. So timings for those user groups, there will be an impact, but we think we can offer what we need to in the current conditions.
Just from a public health perspective, everything we've kind of asked for, everything we've needed, the city has come to the table with. So, you know, we'll get the next pad at the end of March on time so that you can get, you can scale up. Do you need a hockey rink? Do you need a facility? You know, the city has been a real partner on this, and I think that's one of the real benefits of the plan locally is that our governments, our private sector, our public sector, our healthcare sector are all really working on this project together, and you're really seeing that in the lack of barriers and the speed with which we've been able to move.
Do you see a balance upcoming with perhaps pharmacies and doctors' offices getting those vaccines and then, you know, you might not need that ice because they're going to those locations?
Yeah, I mean, obviously the hope is ultimately that we're vaccinating people quickly enough when we get through the kind of mass vaccination program and that more supply and more types of vaccine come online so that we get the bulk of the region vaccinated through this mass vaccination plan. And then as we kind of hit those targets, we're able to scale back some of these clinics, you know, doctors' offices as this pilot kind of goes through. Hopefully more doctors' offices can come online. Pharmacies is also a piece of the provincial puzzle. So the hope is you do this kind of all hands on deck approach, and then you're able to kind of draw that back as you get to kind of toward that herd immunity number.
Can you talk about sort of, if you put into words, where you are in that phase 1 rollout, and are you close to phase 2? Are you in phase 2?
Sure.
Just
So
give us an idea of like, where we're at.
yeah, so it's a bit of a blended approach here. So we've done a lot of phase 1. A big chunk of phase 1 is complete. So you are seeing, and so when we announced the expansion of the pre-registration into phase 2, it's because, you know, I keep coming to this back of having no barriers, is we don't want to get to the end of phase 1 and then say, okay, now we start phase 2, because that means there's a gap in the middle where we're not vaccinating people. So the approach has really been, let's start to get those phase 2 folks pre-registered, let's start to get that moving. And so as we end phase 1, you'll actually see a number of phase 2, and I believe we're already starting to get some of those groups. And the reason is we want to get those vaccines in our arms as quickly as possible.
And just so it's on the record, people should keep calling this public health region and not use the Ontario sign-up method.
Until you hear differently, if you live in this region, if you're an essential caregiver in this region, if you're a priority group worker in this region, you should get pre-registered through our portal. That may change at some date in the future. We are, obviously we work closely with the province and we'll keep an eye on the provincial system. And at some point that switch may happen. And the reason we would switch is because both at the provincial level and the local level, it makes more sense to help get vaccines in their arms faster. But for the immediate term, people should continue to start with the web. If they can web register, we do have the 800 number for people who can't do the web. But yes, please continue to use the local portal for registration.
You talk about the volunteers. I mean, who are these people?
Who are these people?
Who are these people? Where do they come from?
You mean are we just driving a van around the street and plucking people up and putting them?
But they're all volunteers, right? They're all volunteers.
Yeah, I don't know. Can you talk a little bit about who's staffing the clinic today?
So it's a complete mix. So the vaccinators are all nurses at this moment in time, public health nurses or other nurses that have come out of retirement to vaccinate. The people that are doing check-in and check-out are sort of office people, some students as well that are doing that, and of course we have security as well.
Do you imagine security being an issue?
You know what? You always need security to an extent for you know, on the odd occasion that there's crowd issues or an unruly, you know, situation that you need to get in control of. But it's just prudent to sort of, you know, plan ahead. That's all. Do you need it? It's just good planning.
We have them to not need them, which is
Yeah.
better than needing them and not having them.
Do you find people just showing up thinking they can get a vaccine without an appointment?
Not very often.
No.
Okay, that happened earlier on, you know, like in January, you know, when we just started. But no, people understand. I think understand the process.
Yeah, we're seeing a lot less of that, and actually we're also doing some planning around this site change. So, like I said, we've reached out to the people who have been who are scheduled for this clinic to make sure that they know to come here. You know, we're waiting on the city has graciously helped us with a road sign for our Chancellor's Way location to direct people back down here. But people moving forward, if you're scheduled for the Chancellor's Way clinic, you're not. You're scheduled for here.
In terms of staff, how many new staff or volunteers were chosen for this particular location, and how many were kind of taken from, let's say, Chancellor's
run the clinics, we're sort of as a team. So for example, we were running a clinic yesterday in Fergus, so the staff were working there, and the staff were chances were obviously have been redeployed here. So as the clinics scale, I mean, I don't know exact numbers, but we're having to hire to obviously staff the bigger clinics. But we sort of move staff around our public health borders.
Yeah, it's good to know that right now with the current volume of vaccine, we're not running every clinic every day.
Yeah.
So staff are kind of, they're not waking up every morning wondering where they're going to be that day. So we have a schedule, but we are shifting staff around depending on which clinics are running on which days.
How many staff and volunteers do you need to run the clinic every day?
So nurses, I need I'm gonna say about 20, and about 20 like sort of volunteers and reception staff as well. And then we sort of move throughout the clinic to doing different roles, check in, check out, working with flow, stuff like that.
Sorry, is that just for here? Like,
Yeah.
okay. So if you were concurrently running clinics here and in Ferguson,
So it depends on the size, right? It depends on the size. So if I'm running 500 clinic here, I'm gonna need certain amount of stuff, so I can know from my pool of staff that maybe I'll do 300 in Fergus or 300 in Orangeville instead, and sort of drawing from that pool. So, because I'm gonna staff it differently, right, depending on the numbers that I'm going through.
and so today, is this the only clinic that's running, or?
No, so we have clinics, Linamar, UG, now they're doing their own staffing, but we also have, actually, I can't remember where our pop-ups are, but we've got mobile clinics today, I think in Drayton, but I have to check. Pardon me? Drayton's today, yeah.
So it is worth pointing out, just as Camille mentioned, is that we do have really sort of three types of clinics.
Yeah.
So there are public health-led clinics, of which this is one,
Yeah.
of which the two big county clinics are one, of which, those are the three big public health-led clinics. You have partner-led clinics, so those are Linamar, UFG. So the UFG clinic is a partnership between UFG and the local family health team. Linamar is something that Linamar has spearheaded. Now, obviously, we play a role in all those clinics, but they are partner kind of led. And then you have the mobile clinics, the pop-up clinics, the public health kind of spearheads, but we also get support from the local EMTs. And those are the kind of three basic models we have locally for clinics.
And just because Linamar and UG are newer, they're just getting up and running these next couple of weeks, we have staff there, helping them with vaccine, helping them with flow, check in, check out, they just need some support.
Avoid the mistakes we've already made. Learn the lessons we have already made.
That's right, we've been here.
And what kind of mistakes?
See how I walk into that? No, it's not really mistakes, but they really are anything that's a large project like this, at a large facility like this. You're going to learn things when you run 400 people through that you didn't expect even when you were doing your walkthroughs and your setup. So it might be kind of tweaking the direction that people come through. It might be thinking a little bit about how we space so I'll give you a good example. So when we started with the 80 plus vaccinations, we actually slowed it down our kind of cadence of vaccines because they needed a little bit more time. And you can't really know that until you get in and sort of do the process. So it really isn't mistakes, it's about learning, we actually need a staff member over here because people getting vaccinated need a little bit more direction. So it's really about kind of optimizing your process, optimizing your flow, and you really can't do it until you get in there and see how people start to move through the clinic.
In terms of the supply that you're getting in, is sort of a little more consistent than it was a month ago, and are you pretty happy with what's going to come your way in the weeks and months ahead?
Yeah, so it is more consistent. So we are regularly getting vaccine now. We would always take more, right? I think we've shown locally that we really have the capacity to put needles in arms as quickly as the doses come in. But having said that, we understand that this is maybe the first time in history that almost every single person in the world wanted the same man-made thing at the same time, and it didn't exist a year ago. So this is a process, and we knew that this process would look like this, right? And really the fact that you have 4 working vaccines that are available is sort of incredible, right? That a year into this, we have 4 vaccines that work against this virus is amazing. And really, I guess I'll make this aside right now, but all of the vaccines that we have available to us locally are safe. And the best vaccine people can get is the one that they can get kind of right away. So people should, when they are offered a vaccine, they should get it. If people have questions about the AstraZeneca, it's a relatively, it's obviously a new piece of information that's come out of Europe in the past week. There are 2 different, I guess, types or versions of the AstraZeneca vaccine. And so the version that we received in Canada is not the version that they've had questions about in Europe. And the European version is still under investigation, but the rates are relatively low, kind of at the level that you would expect some of those events to happen in the general population. So the big takeaway for people is that the 4 vaccines we have right now are very safe, and people should get them as soon as it is their turn.
You don't have the Johnson & Johnson?
We don't yet have it, no, we just have it for so far.
Any idea when you'll get the 4th one?
I don't know if we've had any news on Johnson & Johnson. Chris? No, so we're still waiting on that. So I would say for the immediate term, most of our clinics will be either Pfizer or Moderna, and the AstraZeneca that you're seeing coming into the region right now is going to be part of this primary care pattern.
Yeah, and in saying about the safety of the vaccines, have there been any reports of severe illness or death related to the regions?
In our region, no. And I think even globally, it is a very tiny
I
fraction.
think the CDC said 1,270 deaths reported in the United States from vaccines.
Yeah, and they've given 100 million plus vaccines. So if that number is accurate, these are still small. When you have a mass vaccination clinic, when you're talking about hundreds of millions of vaccines, you are going to have a small portion of adverse reactions. But by and large, all 4 of these vaccines have been very safe so far. In our region, we've had nothing to speak of as far as I know, no adverse reactions.
No, I mean, you have sort of typical, people.
Sore arms, headaches, fatigue, but no, in our region especially, but also just generally, they have been very effective and very safe.
What's the, I guess the timeline? You know, the provinces, put out April the start of phase 2, like June, July the start of phase 3, and then hopefully most people got a jab by the fall. I mean, if theoretically speaking, if things proceed as they are right now, are we still on that schedule?
We have no concerns locally about meeting those timelines. And really, it is all supply dependent. So our hope for sure is that those supplies keep, I was going to say creeping up, but we hope they surge upward. And that really is the determining factor, right? I mean, I said earlier, we can easily deliver more than 10,000 doses a day here. So we are ready to go. The moment they land in the freezers and the fridges, we are ready to go, and the plan is there. And so we would hope to exceed the timeline, but we certainly don't have any fears about not meeting it, unless that supply changed dramatically, right? Unless there was some sort of dramatic interruption in the supply, we are very confident that we can meet the targets.
But just to paint a rosy picture on it, if we're giving out 10,000 shots a day, we would be done in 2 months, right?
Yeah, I mean, there's about 250,000 eligible people in the region, and if they're all on 2 doses, that's 500,000 doses. So, that's with a lot of supply, we could do it in a hurry. Yeah.
Who's included when you say 250,000 eligible people? Like, no one's talking about vaccinating children right now, I think.
So the vaccines are approved for children. No, I saw today that Moderna announced that they started their pediatric trials. That got announced today. And the reason, so whenever you see an age group associated with these, so there's been some comment around AstraZeneca not being approved for those above 65. There's been some, there's been the monogram does not approve it for under 16 or under 18, depending on the vaccine. But that's just based on the trials. right? So those are based on the results of the trials and who was part of the vaccine trial. So as they go, it doesn't mean that folks above 65 will never get AstraZeneca. It doesn't mean that children might not ultimately get vaccinated, but it's a matter of, as the data accumulates, then they understand and they're able to look at the expansions of other age groups based on the vaccine data.
But when you're talking about that 250, that's not,
Yeah.
that's
That's only
Curfew.
that's the currently eligible group. Yeah, sorry.
Have we seen a decline in people going for tests, or is that still, what are those numbers like?
I'm not sure. So Dr. Tenhoff, who is our AMOH, said last week that we're probably a bit early in our vaccine program to start seeing a real impact in the cases, just because we're only at a few percent vaccinated, and most of those folks, not anymore, but at the beginning of our vaccination, most of the folks who were vaccinated either lived and worked in a long-term care facility. So we're just kind of getting to the cusp. We're just getting into that community-based vaccination. And so it should take some time before we start to see that impact. We will start to see it. We will start to see those trends connect. That's why we're running this massive vaccination program. But we're not nearly into that. Those are kind of glimpses of the future questions, right? Yeah.
But I mean, there must be some kind of indication, because I saw the latest outbreak report for long-term care and retirement homes. There are now 2 homes in the region.
Yeah, so definitely we're seeing a positive impact in those long care retirement homes. Definitely seeing that impact, but in terms of kind of the overall case counts, that's still going to take a while. But yes, it's definitely, you can definitely see some impact there.
I'm gonna ask, you probably don't know the answer, but
That never stops me. So.
good. Any idea, any optimism about wealth changing color next week?
We haven't heard anything yet, so I can tell you what I say every week when somebody asks me this on Tuesday, which is when Dr. Mercer gets asked, when she has her kind of connection with the province, she always advocates for us to be as open as we can safely do. She presents our numbers as they appear locally, but these decisions are still made at the cabinet level based on the direction of the chief medical officer. So I can tell you that Dr. Mercer will look at the cases. Usually she has this call on Tuesday or Wednesday, and then they make their announcement on Friday. But she has consistently said we want to be as open as possible, because this pandemic is hard. It's hard on kids in school. It's hard on our businesses. It's hard on our families. And as open as we can be, we want to be. But it is as open as we can safely be. And that's a real important kind of modifier on that. But I can tell you that when she has her call today or tomorrow, she is going to advocate for as open as the numbers safely suggest we can be. And then we wait, like all of you, to hear what the province says on Friday.
It's usually Friday around 3 o'clock, which is holiday.
Yeah. You can tell where every single communications person in local government or public health is at 3 o'clock on Fridays, which is watching the provincial press conference announcement. Anything else?
Yeah, how many weeks since we first started putting needles in arms?
Sorry?
How many weeks has it been since we first vaccinated?
I think that we gave our absolute first dose on January 6th.
January 6th. Jan 6th.
I feel like a lot of people were in that room. I was there. So we gave a very limited number of doses to members of one of the local long-term care facilities that had been particularly hard hit. We had about 8 or 10 of them come in and get the first shot.
It was like that, yeah. And then I guess the next, yeah.
And then the next day we started to ramp up.
You want to shelter.
Yeah, it was one of the children. Yeah.
And approximately how many have we given out so far?
27,000-ish shots in arms. So that's, some of those would be second doses.
Camille, I didn't catch your last name.
Oh, it's Laux.
How do you spell that?
LOUCKS.
And it was clinic consultant?
Yeah.
See, I remember the second time. Have we talked to everybody other questions? You want to get a...
LOECKS?
Oh, LOU.
LOUCKS. Okay, thank you.
Want to get a look at the clinic? Does anyone want to go on a